Really good question. If someone comes in for bleeding with intercourse, that's my dog. So if someone comes in with bleeding with intercourse, we're going to do a couple of things. Number one, do a really good external exam to make sure there's no lesions or fissures or cuts in the skin where actually the bleeding is just external. Next, we're going to do a really good speculum exam, very thorough, to look at the sidewalls and top and bottom to make sure there's no laceration. The vagina is very vascular, so it can bleed a lot if there is a tear. Then we'll look at the cervix, see, does it look normal? Does there appear to be any discharge that's abnormal? Or is the cervix very friable, which means it bleeds really easily, and some people's just do. We can get into that later. Then I would recommend testing for both yeast and bacteria, because simple vaginal infections are often a really common cause of bleeding with intercourse, and it's an easy fix. I would also recommend testing for STIs, chlamydia, gonorrhea, trichomonas, the usual. And then last but not least, if that all comes back totally normal, or if we have a high suspicion that everything will come back normal, then we talk about potentially doing a pelvic ultrasound. It's not something you have to rush to do, but it's a consideration to see if maybe there's something like a polyp, which is just a overgrowth of soft tissue. It's benign, but can cause some bleeding. And last but not least, I always ask, hey, did you use any lube? Because not enough lubricant can definitely lead to bleeding during intercourse. But let me know if you have more questions.